Tampons are just one method that you can use to capture your menstrual flow. One method of many, but one that you should probably be aware of because they're pretty nice. They're usually made of cotton or rayon, and they are made for one use only, so they are disposable, but not usually flushable. What are the parts of a tampon? Okay, I brought one with me today to show you just one of many tampons that are available. These are the parts. Now, the actual tampon is within this part. That is called the applicator. This is the plunger, and this is the string. Once it's inserted, then this is the part that will be within the vagina, and the string will be hanging out so that you can grasp it to remove it. So why even use a tampon? Well, tampons give you the freedom to move around. You can swim with one in, you can run with one in, and you don't have that bulkiness that you'll experience when you're wearing a pad. Also, once it's in there, you shouldn't be able to feel it as long as it's inserted properly. Why would you not want to use a tampon? Well, they do take a little practice to put in. And at first, it can be a little bit uncomfortable, especially if they're not inserted correctly. Also, when you buy tampons and you open the instructions, you might see some warnings about something called toxic shock syndrome. Now, toxic shock syndrome is very rare, and it occurs maybe somewhere between 0.8 to 3.4 people out of 100,000. So it's really rare. Do I need to be worried about toxic shock syndrome? Well, I wouldn't really say worried. I would just say maybe be aware of it, but know that tampons that are sold in the United States all have to be approved by the FDA, and the FDA tests them to see if they promote the growth of certain bacteria, and if they do, they don't get approved. So if you can buy one here in the United States, you know that it's generally a good product. How do you reduce your risk of toxic shock syndrome? You want to make sure that you wash your hands before inserting a tampon. And then you'll notice that when you're selecting tampons, there are many different sizes available. You want to choose one of the smaller sizes, meaning smaller in terms of absorbency. Because if you choose a really absorbent tampon with the thought that maybe, hey, I only need to change this now, maybe every 12 hours or maybe once a day, that's not the best idea. You could start getting an infection if you leave one in that long. So you want to change it about every 4 to 8 hours, and using a lower absorbency tampon will kind of make you do that. If you develop any unusual discharge or a fever, then you'll want to talk to your doctor and get checked out just to make sure everything's okay. So, how do I insert a tampon? With practice, this will be super easy, but I would suggest, first of all, maybe sitting on a toilet and spreading your legs open, or possibly standing with one foot on the toilet or the edge of a bathtub. That will slightly open your pelvis a little bit. Now, here's the tampon that we were talking about. You want to take this tampon and just use the tip to slowly come past the folds of the vagina. Once you're there, then you want to insert it in the direction towards your back. This is confusing to a lot of people because sometimes they think the vagina goes up and down, but it actually runs a little more horizontal. So insert it in the direction towards your back, and you'll insert up to the level of your fingers. Once you're at that point, then leaving these fingers in place, you'll grab this plunger and push it inside like so, gradually pulling out the plastic. As you do that, the tampon will be left inside, leaving the string coming out. And you can kind of push that string up near the opening of your vagina so that it's not just hanging out for all to see. How do I know it's in the right place? Well, if it's not uncomfortable to you, then you probably did it right. If you can feel it while you're walking around, then it may not be exactly in the right place, or you may not have put it in far enough. So experiment with it a little bit to make sure that you can't feel it. How do I know it's not going to go in too far and float around up in my abdomen? I get that question all the time. The good thing is the vagina is actually a dead end and the tampon can't go in too far. So don't worry about that. What if I can't get my tampon out? Well, this can definitely be a problem, but feel around for those strings. If you can't feel the strings, if you're comfortable, you want to take your finger and just sweep inside the vagina kind of in a circular pattern. And you should hopefully be able to feel the tampon or the strings and be able to pull it out. When you pull it out, you want to pull it out in the same direction that you put it in. So remember, generally a little more horizontal than vertical. If you can't find it, you could even try bearing down a little bit, and it might bring the tampon down to where you can reach it. Most of the time, they don't get lost. Most of the time, you can pull them out very easily. But if you still can't remove it, then schedule an appointment with your provider, and they can help you to take it out. Now, believe it or not, we have had people come into our office who have forgotten that they had a tampon in place. And then maybe they've had intercourse and it got pushed in a little further, or they even inserted a second tampon, which pushed the first tampon up. So if you have one that's lodged up in there and you can't get it out, or you've forgotten that it's in there, you generally will start having maybe some foul smelling discharge. So if that happens and you think there's a possibility that a tampon might be in there, schedule an appointment with your provider so that they can get it removed for you. Now, what if I can't get a tampon in? Don't worry if it's uncomfortable the first few times. That's pretty normal because there is a little learning curve with this, but it should get easier and easier every time. If you feel like you cannot get the tampon to even insert in the vagina at all, then schedule an appointment with your provider or an OBGYN. About 2% of women will have a defect in the hymen, which is kind of like the door to the vagina. And if there's a little defect in that hymen, then it won't allow the tampon to pass through, and sometimes that can cause problems even further down the road. So schedule an appointment and they'll take a look just to make sure everything's okay. If everything's okay, then they can help you with the insertion process there in the office. If it's not okay, then we can talk about other options from there. That's it, guys. Good luck and have fun with those tampons.